Embryonic medicine. What is embryonic medicine? Embryonic medicine is a multidisciplinary science involving doctors, embryologists and geneticists specialized in embryonic analysis. Its objective is to increase the birth rate of healthy children, free of chromosomal syndromes or hereditary diseases. Embryonic medicine considers each embryo to be a tiny patient. When applied to patients with a history of in vitro failure, it is revealed that many embryos present chromosomal alterations. It is known that these alterations increase considerably as women get older, as they also do in cases in which sperm quality is low. Embryonic medicine also allows us to determine whether these alterations originate in the male by using a series of techniques such as meiosis and FSH to analyze the chromosomal load of the sperm. Most importantly, all these techniques allow us to discover why previous pregnancies have failed and at the same time encourage the birth of healthy children. Embryonic study. What is preimplantation genetic diagnosis? The genetic study of embryos is a diagnostic technique performed on the embryo prior to it being implanted in the uterus. Preimplantation genetic diagnosis provides information on the state of each conceived embryo and only allows healthy embryos to be transferred to the uterus. Preimplantation genetic diagnosis is the combination of in vitro fertilization and genetic analysis. At Institut Marqués, thanks to our commitment to research and development, we can analyze all the embryo's chromosomes in one cell. This allows us to detect more abnormalities and improve the chances of pregnancy. In advanced maternal age, we can even increase the chances of pregnancy by 3. In order to proceed with the analysis, embryos must have been submitted to an in vitro fertilization cycle. The ideal moment is on the 3rd day of development following fertilization. An embryo cell is then extracted using a technique known as an embryo biopsy. How is preimplantation genetic diagnosis performed? An embryo biopsy consists of extracting 1 or 2 cells from the embryo. However, this does not compromise normal development. Once the biopsy has been performed, the embryo is returned to the laboratory incubator, where it will be kept in an in vitro culture medium under adequate environmental conditions and allowed to continue its development. A common fear in couples being subjected to this study is whether the embryo may be damaged during the process. The answer is no. The genetic information is present in each and every one of the remaining cells, and this process does not affect the evolution of the rest. Once the biopsy has been done and the cell has been extracted, it is processed for analysis and subjected to genetic study. A detailed report on the results of the analysis is forwarded to the assisted reproduction team, who, with the clients, decide on the number of healthy embryos to be transferred. Transfer is performed immediately following analysis, normally 4 days after oocyte retrieval. Preimplantation genetic diagnosis increases the pregnancy rate and diminishes the risk of spontaneous miscarriage. Who can benefit from preimplantation genetic diagnosis? Infertile couples. All couples opting for assisted reproduction techniques who wish to increase their possibility of conceiving. This technique is particularly indicated in infertility of unknown causes, patients who have been submitted to at least 2 unsuccessful in vitro fertilization cycles, patients who have suffered at least 2 previous miscarriages, or patients with severe masculine infertility. This technique is equally recommended in patients presenting pathological meiosis or fish in altered sperm, couples with abnormal karyotypes, or women over 37. As with amniocentesis, preimplantation genetic diagnosis is recommended in women of 37 plus, as the percentage of embryos with chromosomal abnormalities increases and on frequent occasions is the visible cause of pregnancy failure following various in vitro fertilization cycles. In these cases, preimplantation genetic diagnosis for the study of all the chromosomes is the most appropriate technique. Preimplantation genetic diagnosis is also useful in cases in which karyotype or chromosome map alteration is observed of one member of the couple. This is known as chromosome translocation or reorganization. All the genetic information is there, however mapped incorrectly. Consequently, this may result in embryos with chromosomal abnormalities, hence leading to infertility or repeated miscarriages. Preimplantation genetic diagnosis only allows the transfer of well-balanced embryos and discards any affected embryos. Couples with hereditary diseases. Preimplantation genetic diagnosis is particularly interesting for couples presenting hereditary diseases such as haemophilia, cystic fibrosis, Fanconi anemia, Marfan syndrome, Fragile X syndrome, muscular dystrophy, or Huntington's disease, to mention just a few of the most common. In spite of being heterogeneous, all of these diseases have several factors in common. They all tend to be serious, chronic, weakening, and progressive, and treatment is normally palliative, not to mention the difficulties that arise when diagnosing the condition. In addition, they imply side effects, lack of autonomy and ability, and in the most serious cases seriously compromise the quality of life of those affected. Until recently, couples affected by hereditary diseases either had to resign themselves to the fact that they could not have children or take a chance and see whether their offspring developed the disease or not. Today, Preimplantation genetic diagnosis offers you access to hereditary disease-free embryos, hence eliminating the possibility that your child may be born with such an illness. In the Institut Marquès, we can perform preimplantation genetic diagnosis on all known genetic diseases at present. To analyze the genetics of sperm could represent a key factor to properly guide a treatment and achieve an evolving pregnancy. In recent years, the team of reproductive biology at Institut Marquès have specialized in the genetic analysis of male infertility. They do this through 3 tests: the study of meiosis, the DNA fragmentation test of sperm, and the fish technique applied to the sperm. A study of meiosis in testicular biopsies. Meiosis is the natural process by which the sperm stem cell chromosome count is reduced by half. It reduces from 46, those normally present in each sperm, to 23 chromosomes. This process often displays alterations and leads to reproductive failure. The origin of these anomalies is as yet unknown. It is supposed that in the majority of cases, the origin is of a congenital nature and developed during the embryonary fetal testicular development phase. Other elements, such as toxic environmental factors, may also lead to this kind of anomaly in the adult stage of life. The fact is that the incidence of anomalies in meiosis is inversely proportional to sperm concentration in ejaculate. A meiosis study involves the analysis of a tiny fragment of testicular tissue. This is particularly indicated in cases in which sperm is not found in the sperm study. The DNA fragmentation test. For a good development of the embryo and fetus, it is of vital importance that the chains of the DNA in sperm are complete and intact. The more breaks in the chain, the greater the chances of infertility, repeated abortions, or in vitro fertilization cycles without pregnancy. Institut Marquès offers one of the techniques that makes it possible to detect the level of broken genetic material of sperm, the DNA fragmentation test, an essential test to detect the origin of male infertility. When damage in the DNA chains is detected, the medical team will recommend a solution in order to improve the prognosis. This could be a treatment with antioxidants, high magnification sperm selection, IMSI, or sperm retrieved directly from the testicles, TISA. Fish applied to sperm. The sperm fish is a technique that allows us to study the number of chromosomes within the sperm. All you need is a semen sample collected in a sterile vial. An abnormal fish study indicates chromosomal abnormalities in sperm. This means that if that sperm were to fertilize the eggs, they could become chromosomally abnormal embryos. For that reason, in this case, we study and identify embryos that are chromosomally normal through a cycle of IVF with preimplantation genetic diagnosis.